Do you have a pinched nerve in your neck that's sending pain signals shooting down your arm? Or maybe even experiencing numbness and tingling or strength issues? Well, if you said yes, you may be experiencing what's called cervical radiculopathy. In today's video, we will be discussing what you should know about this condition, from its causes, symptoms, diagnosis, and what you can do to make life a little less painful. Hey everybody, welcome back for another episode of PhysioShow, where we answer all of your rehab-related questions. The term cervical radiculopathy is just a fancy word used for a condition that involves irritation of one or more nerves exiting out from the joints in the neck. This irritation can be incredibly painful, sending shooting, zinging pains down the arm, and giving you the sensation like part of your arm is tingling or asleep. You may even notice weakness in your arm or hand. But what causes it? Well, you see, we all have these nerves that exit out of the spaces between our vertebrae, just like a tunnel. And there is not a ton of space to begin with, so anything that results in compression of these spaces can cause issues. The likelihood of experiencing cervical radiculopathy tends to increase with age, and based on your age, you can make an educated guess as to the cause of the symptoms. For example, generally those in their 30s and 40s tend to experience symptoms due to disc herniation, while those over the age of 50 years old often experience symptoms due to spinal degeneration, causing narrowing of the joints in the neck. Now, these are not the only causes of cervical radiculopathy, but they're the more common ones. Whether symptoms are due to herniated discs or due to arthritis, these nerves need space, and when they get pinched, they let you know about it. This can also happen due to trauma, resulting in inflammation of the nerve in the neck. But how do you know if it's a pinched nerve in the neck and not something else? Diagnosing cervical radiculopathy is typically straightforward for an orthopedic physical therapist in a clinical setting. They'll conduct a neurologic examination, checking your reflexes in the upper body, assessing muscle strength in your shoulders, elbows, and wrists, testing sensation in the various parts of your arms, and evaluating your neck mobility. They'll also observe how your nerves in your arms move to detect any limitations. Typically, individuals with a pinched nerve show reduced reflexes, weaknesses, and diminished sensations in their arms. This occurs because when a nerve is compressed, the muscle it controls and the corresponding sensory areas in the skin are affected. People may also experience restricted neck movement on the side where they feel pain, sometimes causing shooting pain down the arm when they rotate their head in the direction of symptoms. A test called the Sperling's test is often utilized as part of the examination. This is where the therapist will place pressure on the top of the head, reproducing compressive forces. If symptoms shoot into the arm or back of the shoulder with this test, you likely have a pinched nerve. On the flip side, applying gentle traction to the neck by giving it a slight pull can sometimes provide relief by giving the nerve more space, resulting in reduced arm pain. Now you may be wondering, this sounds bad. Shouldn't I get an X-ray or an MRI? Well, not necessarily. Again, this condition is generally easy to identify in the clinical setting, and diagnostic imaging is not necessarily going to add more value to a comprehensive assessment that was performed in the clinic by an orthopedic therapist. In other words, it's likely not going to significantly change how it is treated conservatively. Now, imaging does come into play when conservative treatments like physical therapy, medication, and rest have not provided sufficient relief for cervical radiculopathy. If symptoms persist or worsen despite these measures, imaging will likely be indicated for the purpose of spinal injections to help manage pain and inflammation more directly, or for surgical management if unresponsive to injections. MRI is typically the best choice of imaging for cervical radiculopathy, as it provides the ability to see soft tissues such as disc herniations and the nerves that exit the neck. This will also help to determine the degree of compression in the presence of any swelling around the nerve. Another diagnostic tool called electromyography, or EMG, may be utilized to assess nerve function and is most useful when combined with MRI in cases with unclear symptoms or inconclusive imaging. Now, with such an uncomfortable condition, everyone wants to know how long it will take for this thing to heal. Unfortunately, there is no clear way to know, as the severity of nerve compression can vary, and even that doesn't always correlate with the severity of symptoms. But the good news is that most people do improve without the need of surgery, despite how uncomfortable it can be. Generally, most people experience resolution within 3 to 6 months, with early treatment and adherence to recommended interventions helping to speed up recovery and prevent symptoms from intensifying or becoming chronic. Are you wondering what you can do to help with the pain and keep symptoms from coming back? Well, check out this video for the next part of the Cervical Radiculopathy series. And don't forget to like this video and consider subscribing to the channel to learn more about your body, how it works, and what it needs to keep moving.